What is the future of biofeedback for bladder health? Imagine a tool that helps your body learn to control its own bladder functions better. That's what biofeedback aims to do, especially for those with bladder issues like neurogenic bladder or incontinence. As technology advances, biofeedback is becoming more sophisticated and easier to use, opening new doors for managing bladder conditions. Right now, biofeedback works by giving patients real-time feedback about their pelvic floor muscles. Devices can use electrodes placed inside the vagina or on the skin over the pelvic muscles to send signals. These signals help patients see or hear how their muscles are working during exercises. Some systems display graphs showing muscle activity, so patients can learn to contract or relax muscles more effectively. Others use electrical stimulation to promote passive muscle movement, helping retrain muscles that aren't functioning properly. For stress urinary incontinence, recent studies show promising results. Many patients experience significant symptom reduction after about 12 weeks of therapy. More than half of the women with stress incontinence have reported complete symptom relief in some trials. Patients also report high satisfaction, with many willing to recommend biofeedback therapy. It's especially helpful when combined with pelvic exercises, improving muscle strength and control. In cases of bladder leakage after prostate surgery, biofeedback combined with pelvic muscle training can improve muscle tone and continence. Patients typically attend weekly sessions lasting about an hour, over 10 weeks, and follow personalized home exercises. This approach helps retrain muscles and may lead to better bladder control, thanks to the brain's ability to adapt and learn new control patterns. Biofeedback also shows some benefit for pelvic organ prolapse, where the muscles supporting the bladder weaken. Electrical stimulation combined with muscle training can improve muscle function, but results vary, and some patients may need longer or more intensive therapy. Despite these positive signs, the evidence isn't entirely clear-cut. Some reviews suggest that adding biofeedback to standard exercises results in only small improvements that might not be noticeable in daily life. For some conditions, studies show little difference between using biofeedback or just doing exercises alone. In post-prostatectomy patients, results are mixed, and more high-quality research is needed to confirm if biofeedback truly offers a significant advantage. Looking ahead, the future of biofeedback is exciting. New devices are becoming more user-friendly, often non-invasive, and easier to access. Researchers are exploring ways to incorporate biofeedback into routine post-operative care, which could lead to better recovery outcomes. Personalizing treatment based on who benefits most from biofeedback is another promising area. For example, some patients might respond better depending on their specific condition or neural function. Long-term studies are also essential. We need to understand if improvements last 4 years or fade over time. This will help doctors recommend the best treatment plans. Advances in understanding how the brain and muscles communicate, known as neuroplasticity, are helping improve biofeedback techniques. Virtual reality and gamification are being tested to make learning muscle control more engaging and effective. Safety is another big plus for biofeedback. It's generally very safe, with few side effects. Minor discomfort or mild urinary symptoms can happen but are rare and usually not caused by the therapy itself. Because it's non-invasive and drug-free, biofeedback is a good option for many people seeking conservative treatment. In the context of neurogenic bladder, where nerve damage affects bladder control, biofeedback can be part of a comprehensive approach. It helps patients regain voluntary control when some nerve signals are still intact. Combining biofeedback with other therapies like bladder retraining and lifestyle changes can lead to better overall results. Moving forward, research will focus on identifying which patients benefit most, refining delivery methods, and integrating biofeedback into standard care pathways. Well-designed clinical trials are needed to compare biofeedback with other treatments and to measure long-term benefits. Cost-effectiveness and patient satisfaction will also guide future use. Overall, the outlook for biofeedback in bladder health is cautiously optimistic. It has proven benefits for certain conditions and continues to evolve with new technology and research. As we learn more about how the brain and muscles work together, biofeedback could become an even more powerful tool in managing bladder problems. Still, it's important to remember that every person is different, and treatment should always be personalized. Always consult healthcare professionals to find the best approach for your specific needs.